Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the segmental CBCT of the patient that you had requested. The area of interest highlighted to us by our doctor is the upper right lateral incisor and the upper right canine. Now, this is the 3D rendering. Moving to the panoramic view, here we can see that the upper right lateral and the canine seem to or appear to be normal. But on the transaxial view, which is the proximal view, here we can clearly see that there are signs of internal resorption present in the upper right lateral incisor. It is very clearly visible on this section that the upper right lateral incisor has a significant internal resorption, which is in very close contact to the palatal aspect of the tooth. There does not seem to be perforation, but this, as you can clearly see, is going to be a challenge to treat because this resorption needs to be treated as soon as possible. Otherwise, once the perforation is done, the treatment outcome is or the prognosis of this tooth is going to be significantly lower. If we can highlight the approximate working length from the chamber opening area, it is going to be approximately 16 millimeters. Now, moving on to the canine region, the canine appears to be normal. We don't see any periapical pathologies, but we do see a slight radio opaque, radiolucent area or a hypodense area right next to the tooth. We don't see any cavities and we don't see any significant problems as such. But if we can highlight the working length for our kind doctor from the chamber opening area is approximately 20 millimeters. Now, moving to the axial view. On the axial view, we will be able to highlight some key factors of this tooth. This is the lateral incisor. This is the central incisor. Now, moving to the crown section. This is the crown section, but as we move apically, the lateral incisor shows the signs of internal resorption right here. There is a separate canal in the upper left lateral incisor, but on the upper right lateral incisor, we can see that this is the internal resorption that is going on. And as we move apically, the internal resorption goes away. So there are no significant radiolucencies associated with this tooth. The canine appears to be normal on the panoramic scan. Here we can see this is where the premaxilla is not completely attached in the midline. This is the incisive foramen region. Other than this, we don't see anything other significant. If you have further questions regarding this case, please feel free to reach to our team. Thank you very much.